Hi everybody, welcome into HealthWise, the TV show, and I'm your host, Ralph Hipp. You know the time when you or a loved one are transitioning back from hospital or rehab center care to go home is critical to making sure you stay on the road to recovery. There are services and benefits in place to help you make sure you're successful at home and don't end up back in the hospital. Ed Schulte is with me today. Ed's the Executive Director, co-owner of Caregivers Home Health, here to share with you and me some of the home health services providing those critical supports. And you'll want to definitely stay with us for the next 7 minutes here. Ed, good to see you again.
Good to see you again, Ralph.
And so everybody wants to go home, like they don't want to be in the hospital. I want to go home, but 1 of every 5 of our seniors is back in the hospital within a month. And why does that happen?
You know, I think it's one of those things that we call a boomerang effect. Everybody thinks they know what a boomerang is. Very few of us really have much experience with them. And we
know that we throw it out there and it comes back.
We throw it out there and it comes back unless we do something. And that's one of the things with the hospital stay. I think we all have an idea that we think we know what we will do when we come home from the hospital. And many times we find out it's more complicated than what we thought.
How is the boomerang effect bad for the patient, and it's bad for the hospital, and it's not too good for the rehab center either?
It's not good for anybody. We've seen with the changes in healthcare that hospitals tend to keep patients for a shorter period of time in the hospital, and they are sending them home sooner. And because of that, they need more support services. People bouncing back to the hospital or boomeranging back actually cost over $26 billion per year in the United States.
With a B.
Billion with a B. So this is a big issue, a big concern. When you think of that as in 1 of 5, 20% end up going back into the hospital.
Right.
That's a huge issue.
Talk about the cost of that at a time when the nation and even in our family, we try to control those healthcare costs. But this is requiring people that are working 24/7.
It does. When you think about what happens in a hospital or a rehab center and the care that you receive there, you're receiving care from a team of people pretty much around the clock to make sure that you're getting everything that you need in terms of your rehabilitation with physical, speech, occupational therapy, your nursing services, the medications that you're getting, and just the day-to-day living kinds of things as far as cooking, making sure you're getting meals, getting to the bathroom, and everything done in a safe way. So that's a huge thing when you're going from 24-hour care to home with support services there.
Talk about the training, the compassion of the people who are on the team when these people are ready to go home.
We have a great team of professionals, and we see them be able to really use their skills. It's one thing to do services in a hospital or rehab center, and they do great services and work there. But at home is really where the rubber meets the road and where it takes people that are really committed to try and keep people at home, keep them safe, and figure out what's going to work for them in their home. One example would just be physical therapy as far as figuring out how we can safely transfer into a wheelchair and back into a bed or into a chair. That's a whole different issue when we talk about people needing to get into a bathroom that the wheelchair may not fit through.
We're with Ed Schulte of Caregivers. And Ed, is this considered in the billing process a luxury or a necessity? How much of this would be covered by Medicare?
It's one of those things that is considered an absolute necessity and one of the few things that Medicare covers at 100%. They will cover once a year physical exam, they will cover flu shots, those at 100%. No copay, no deductible. They actually do the same thing, Ralph, for home health services because it's so expensive, so hard on patients to go back into the hospital that it's one of those few times that government programs, Medicare, the patients, the people treating them, we're all on the same side to try and keep them at home, out of that hospital, and keep them from returning. It
doesn't benefit anybody to keep them away from home. It's good for everybody when they can have the home care.
Absolutely.
Right. What about, talk to me, Ed, about the differences of a doctor that you see in the hospital or the rehab center. They come and visit you often, as opposed to the concept of the house calls. And would the doctor come to you when you're home?
Well, home health really is that extension of what used to be house calls as far as physicians going to people's homes and providing those services there. And the reason they did that was because it was such a good way to deliver services with people getting better at home. These days, doctors typically aren't able to do that, but we actually work with the patient's own doctors. So it's the doctor that knows you, that is providing services to you, that we work with as part of the team to make sure that we can be their eyes, hands, ears, and therapists in that home setting.
Ed, we're about 2 minutes away from doing some exercise here on HealthWise, but in our final 2 minutes, Talk to me about whom you call the Boomerang Breaker team. They include RNs, they include therapists, and who else?
We do call them a boomerang breaker team because they want to break that option as far as people going back to the hospital. So we do have registered nurses, we have physical therapists and physical therapy assistants, occupational therapists, speech pathologists, medical social work, and one of the most important people on the team is home health aide that actually can help people with bathing services and some of those things.
They are a bath aide. You call
They
them
are a bath aide,
yeah.
and they will come out 1 to 3 times a week and make sure that people are getting their bath, getting taken care of as far as some of their ADLs, and that makes such a difference as far as their health as well.
Absolutely, and they just feel better when they can have that particular personal care. What about the medical social work? What do you mean by that, Ed?
That person is really one of the key people to the team to make sure that we're all working together and accessing those community resources, knowing who to go to at that time that home health services are no longer there. So our job is to make sure that the patient is able to carry on, stay at home after we're gone, and to utilize those community resources, such as Stormont Vail provides.
Our wonderful people at Stormont Vail. This is Ed Schulte, a wonderful guy from Caregivers. Ed, thank you. And you can reach them if you'd like to know more about what we've talked about on this segment. 354-0767, right, Ed?
That's absolutely right.
All right, and you can call. Can they, in the few seconds we have left, can they add on a service that you might provide optionally?
We do have optional services for people that would be private duty services.
Right.
For people that's not covered by Medicare, but we can do that on a private pay basis.
Ask about that as well, 354-0767. And this is Ed Schulte. Ed, we appreciate it, and we'll see you very soon, I'm sure.
Thank you so much.
Happy holidays to you.
Same
Absolutely.
to you.
All right. Okay, now time for our HealthWise TV exercise segment, and we have some very fun, very invigorating, some very low-impact exercises we'd love for you to follow on with our exercise leader. And I remind you to be sure to consult with your doctor before you start this exercise or any exercise program. I'll see you again right here next Friday morning on HealthWise, the TV show.